Hello, my name is Dr. Nicholas Cohen, and I'm here to share with you my top 10 list for people with chronic low back pain. Tip number 1. The best way to prevent chronic low back pain is with exercise. It's important for everybody to exercise for at least 30 minutes a day on most, if not every day of the week. You can accomplish this goal by walking for 30 minutes a day, every day of the week. People who are physically active have a less risk of developing chronic lower back pain. Tip number 2. Prevent lower back pain by maintaining a healthy weight. People who are a healthy weight have a less risk of developing chronic lower back pain. The best way to know if you are overweight and need to lose weight is to find out your body mass index, your BMI. You can go online and you just Google BMI calculator and put in your height and weight. If your BMI, your body mass index, is more than 25, then that means you're overweight, and it would be beneficial for you to lose weight, not only for a whole lot of health benefits, but because it will also help prevent lower back pain. Tip number 3. A third great way to prevent lower back pain is to maintain good posture. If you're lifting a heavy object, it's important to bend with your knees and not with your back. If you're in a job where you're sitting or standing for prolonged periods of time, then it's important for you to take frequent breaks to change your posture and stretch. Tip number 4. If you have chronic lower back pain, it's important to see your doctor. Chronic lower back pain could be a sign of a more serious illness, and it's important to see your doctor before you decide to treat it with other therapies that I'm going to mention now. So, if you do have chronic lower back pain and you've seen a doctor and it's been determined that it's not a serious condition, tip number 5 is to remain active. This is probably the best way for people to overcome chronic lower back pain. Remaining active is one of the best things you can do for your back. Studies have shown that people with low back pain recover faster when they remain active. Movement helps to relieve muscle spasms and prevents loss of muscle strength. Tip number 6. These are 4 exercises that I recommend for people with chronic lower back pain. What they do is they strengthen the stomach muscles, the back muscles, and the leg muscles, and this provides support for the back. The first one's called the pelvic tilt. The way to do this is to lie on your back with your knees bent and your feet flat on the floor, and then tilt your pelvis inward so that the small of your back becomes flat with the surface of the ground. Hold this for 5 seconds and then relax. And do this 10 times. Repeat this every day, and this will help strengthen your stomach, back, and leg muscles. Tip number 6 is just bringing your knee to your chest. Lying on your back, with both knees bent, feet on the floor, take one leg with your hands and pull it into your chest. Hold this for 10 seconds and repeat it on the opposite leg. Do this exercise every day. You can repeat the exercise for 10 repetitions on each side. Tip number 3 is a crunch. Lie on your back on a firm but soft surface and bend your knees with your feet flat on the floor. Then lift up either with your arms crossed on your chest or your arms extended outward. Lift your upper back up so that you're stretching towards your knees, and hold this position up in the air for at least 10 seconds. And then let yourself back down. Repeat this on both sides for 5 times and do this every day. This is a great exercise for people with chronic low back pain. The 4th exercise is just the twist. So, sitting on your butt with your legs straight out in front of you together, take your right leg and cross it over your left. Place your right foot on the outer side of your left knee. Then, with your right arm, put it across your right knee and just hold that for 10 seconds, and then repeat it on the other side for 10 seconds. Do this on each side for a total of 5 times each, and repeat this exercise every day. Tip number 7. If you've tried all of the things that I've mentioned so far, and you're having an exacerbation, an attack of your lower back pain that's gotten worse, then you can try over-the-counter pain medications. It's important to ask your doctor what's the best pain medication for you, but 2 of them are the most recommended, the first-line medications. The first is Tylenol, and the second are non-steroidal anti-inflammatories, and that includes ibuprofen and naproxen. So acetaminophen or Tylenol has less side effects, but it should be avoided in people who abuse alcohol or have liver disease. On the other hand, non-steroidal anti-inflammatory drugs are more effective, but they also can cause more side effects. And they should be avoided in people who have risk for gastric ulcers or have risk for kidney disease. So when you take either of these over-the-counter drugs, it's important to take them on a scheduled basis, not just when you're having pain, but this is a way of controlling an attack of your pain, and you should be taking it scheduled, not just when you need it, because it works to reduce inflammation. So it's important to take it on a scheduled basis, according to the package directions, for 3 to 5 days. Tip number 8. There are 2 recommended drugs that you can get with a prescription from your doctor. And they're recommended basically if you've tried Tylenol, you've tried Aleve, you've tried exercises, and you've tried remaining active, and none of those things have worked, and your back pain is severe. The 2 medications are tricyclic antidepressants and opioids. Tricyclic antidepressants are helpful for chronic pain, even if you don't have depression. And opioids are helpful for people with severe, debilitating pain that doesn't respond to other medications, and only when it's used for short periods of time. Tip number 9. There are several other additional therapies that have been shown to be effective for people who are motivated to do them. So if any of the following therapies seems interesting to you and you'd like to try it, there is evidence that shows that it can be effective in helping you with your lower back pain. Those therapies are acupuncture, yoga, massage, and cognitive behavioral therapy. And tip number 10, believe in yourself. You absolutely can control your lower back pain, not only by preventing it from getting it worse, but by managing the pain as it goes and improving your symptoms by strengthening your body. So I hope you take some of these tips and apply them, and I hope your back pain gets better. Thank you very much.